As we reflect on the past year, we are filled with gratitude for the support and dedication of our members, partners, division, and primary care network teams. We are proud to share our accomplishments and outline the strides we have made towards a healthier community. We want to acknowledge that we are on the traditional, unceded, and stolen territory of the Semiahmoo, Kwantlen, and Katzie peoples. We also recognize the Métis people and Métis chartered communities, Inuit, and urban indigenous peoples living in this territory. We are all one. May the spirit of reconciliation guide us in all we do. Our division exists for our more than 200 members, and together, we influence the delivery of healthcare in our community. We form opportunities for connection with colleagues and ensure there is a collective voice representing family physician needs and priorities. All family physicians in our community are invited to participate in planning and programs. Ultimately, we are working towards creating a thriving community of family physicians delivering quality care and leading the future of healthcare in our community. We do all of this working in collaboration with you, our members, our community, and medical partners. Our initiatives are focused on improving primary care in White Rock, South Surrey, and reflect what physicians and patients want for healthcare. We continue to have a dedicated staff person to recruit and support the retention of family physicians. We hold education sessions throughout the year on topics members have expressed an interest in. We promote physician wellness events and stories in our monthly newsletter. We host a clinic managers network, which is a valuable space for sharing of best practice and information. We work closely with Catherine Torrance and the Practice Support Program to promote quality improvement and connect new physicians to resources like Pathways. We educate on cultural safety, work to improve access to care and systems to attach patients to family physicians and nurse practitioners. These initiatives are designed and delivered through collaborative working groups that are physician-led. And finally, we heard that family physicians want more support around running the business of a clinic. So we have a family physician business group, and attendance is increasing, showing a need for this type of information and support. Thanks to our recruiting efforts, we continue to have family physicians join us from other countries. During April 2023 to March 2024, we welcomed 15 new family physicians and 1 new nurse practitioner, plus welcomed many specialists and residents as members. To say hello to new physicians and to honor those that retired, we hosted our annual Hello Goodbye event. This year, we had 100 members and guests attend. To help with recruiting physicians to our community, we developed a beautiful welcome guide with insights about practicing medicine locally and connections to resources and programs such as schools, real estate, shopping, parks, and more. To help physicians get settled into our community, we developed a helpful onboarding guide that has information about who's who in healthcare in our community and in our province. And we've heard from physicians who were new to British Columbia say, "I wish I had this information when I started working here." In partnership with Fraser Health Authority, we started implementing our primary care network in 2020 and continue to strengthen team-based care within family practices. The goal being reduced burden for physicians, increased physician satisfaction, and ultimately improved patient care. Celebrating our 4th anniversary at the end of March 2024, our primary care network team now includes 90 family physicians. This is close to 100% of family physicians practicing in our community. We also have a full complement of clinicians working as part of the team. Family physicians are working daily with neighborhood nurses, social workers, and a pharmacist as part of their existing clinic team. Our model of team-based care is grounded in each person working to their professional scope, highly effective communication, and strong relationships. Supporting these teams, the Primary Care Network are patient educators who design and deliver education resources and materials for physicians, clinicians, and patients. A mental health educator who provides clinical support and expertise, as well as education for providers and physicians. An example of the team-based care approach is the new collaboratively developed lateral referral process. This has benefited the social worker team by allowing neighborhood nurses to take on some social work tasks, enabling social workers to address high-priority referrals more promptly and engage with patients needing direct support. Another example of coordinated care is when a family physician sees a patient and gives them a health diagnosis and then connects the patient to the PCN neighborhood nurse, who can spend time with them on the phone or in their home, educating the patient about their health condition, sharing resources with them, and following up to see how they are doing. The physician can also connect with the PCN pharmacist to dialogue about the multiple prescriptions the patient may be on. The pharmacist then connects with the patient and finds out if there are any complications with their medications, and the pharmacist will then loop back with the physician to share any recommendations or updates. White Rock, South Surrey patients can receive up to 8 free counseling sessions with Source's Community Resources Center counselors, funded by our PCN. We hear regularly from patients that this service is valuable and beneficial to their well-being. Our PCN patient educators are offering free group education classes. This includes lifestyle management, chronic pain, and blood pressure series. See Pathways for more details. Additionally, our PCN patient educators partnered with our PCN pharmacists and nurses on pain management. This helps increase patient confidence to self-manage their pain and achieve improved health and well-being. We are expanding our PCN into community services. For example, the maternity clinic refers patients to PCN nurses. The nurses provide care through home visits, telehealth visits, and clinic visits. They help patients with a variety of topics from lactation support to blood pressure management. The nurses also make referrals to social workers for added support. Another example of expanding PCN into community services is the Congestive Heart Failure Pilot Project. Our PCN nurses are proactively reaching out to patients to help them manage the disease, from weight management to monitoring fluid retention. Initial data from the 1-year project has been very positive, showing less readmittance to the hospital. We are planning to expand this proactive education approach into other health conditions and post-discharges. We have 11 family physicians available 24 hours, 7 days a week for care to 13 long-term care facilities in our community. This program ensures that care conferences are regularly taking place, that patients are seen by a physician in a timely fashion upon coming into long-term care, that medications are being reviewed regularly, and thorough documentation is being completed for each patient. The goal of the program is to also work closely with our hospital to avoid admission to the emergency department from long-term care. This helps reduce the overall system burden that can often be faced by acute care. Engage Communities Canada Society operated the Warming Centre in White Rock from November to March. This collaboration resulted in a healthcare team scheduled each day of the week to provide care for people accessing the center. One of our local family physicians and a PCN registered nurse spent Friday mornings at the center providing health care as needed. We are continuing to work with unhoused people in our community by going to where they are located and continuing to partner with other community services. Transformative reconciliation and our approach to this work has become a significant part of how we see our future. We have embarked on a path of exploration and discovery into the world of truth and reconciliation, and we are responding to the many calls to standards, declarations, and legislation. Our overall approach is focused on learning and raising of our individual awareness, and this focus is designed to be in service of creating actual change. The journey towards truth and reconciliation is a commitment that can be imagined as being a good neighbor, and one that involves a great deal of learning and unlearning. We are promoting and supporting Indigenous-led education for family physicians, clinicians, and community partners to deliver anti-racist, respectful, and culturally safe care. We continue to participate in these groups, tables, and task forces to integrate primary care with social services in our community. Together, we are improving health outcomes and addressing social determinants. Our work with our Fraser Health Authority partner is foundational to much of the system improvement work we are engaged in. For example, co-chairing leadership tables such as the Collaborative Services Committee ensures we are working together with Fraser Health to tackle complex healthcare problems in our community. We invite you to follow us online and keep up to date about your division.